One of the common ways to find out exactly what kind of cancer your dog has is using a diagnostic technique that involves a fine needle aspirate. So I'm going to ask you, Dr. Ettinger in New York, what's the process of using a fine needle aspirate in the biopsy proceedings?
Sure. So a fine needle aspirate is a little less invasive than a biopsy. With a fine needle aspirate, your veterinarian is going to use a needle and a syringe, kind of just like they're getting a blood sample. But in general, they're going to insert the needle with a syringe into the lymph node or the skin mass or the subcutaneous mass and collect some of the cells back. They'll put it on a microscope slide, and that will go off to the lab to be looked at under the microscope. The biopsy is slightly more invasive because you're actually taking a core of tissue, and that in general is a little bit more thorough for the pathologist who's looking at those cells under the microscope. But we will typically start with a fine needle aspirate because it's a little less invasive and a little less expensive, and it can at least tell you whether the mass on your pet is a cancer or an abscess or an infection, and at least gives you a place to start with your pet's diagnosis.
Dr. Dressler, is that usually done under general anesthesia?
It depends what we're talking about and what we're testing. The superficial ones, which is out on the skin, those usually will start, as Dr. Ettinger pointed out, with a fine needle aspirate. And it's very, very simple. And it literally, as far as the pet is concerned, only takes, well, I would say about 4 or 5 seconds to retrieve the sample. But a biopsy is a different story, and those require either very deep sedation with a local block. A local block is like a Novocaine type block on the skin, or anesthesia, because there we're collecting a piece of tissue or the whole growth to be checked, and that requires anesthesia.
And then that's usually done by a regular veterinarian. Does that need to be done by a specialist, or is your regular vet a good person to do this?
It depends on what stage we're talking about. Dr. Ettinger, did you want to jump in on that one?
Well, I think, it depends on what organ or where the mass of concern is. If it's a liver aspirate or a liver biopsy, that might be done, ultrasound guided, and there might be a specialist involved. It really depends on how comfortable your veterinarian is doing that procedure. Some general practitioners do them, but sometimes they will send that off to a specialist. So I think it really depends on how superficial the mass is. Is it likely to cause bleeding, or, what are the risks of collecting that sample? So it's hard to make generalizations for, some of these.
Okay, so once the sample is collected, it's sent off to a lab. How long does it usually take to get the results back?
It depends on your veterinarian's lab. We actually have a pretty quick turnaround time for cytology. We get them back within 24 to 48 hours. And
you're in New York. What about in Hawaii? How long does it take where you are, Dr. Dressler?
For a fine needle aspirate, it's usually about a week. And for a biopsy, it's closer to 10 days. Simply because of shipping. Although we do, FedEx the specimens out, there's obviously a more delayed interval between submission and getting the results.
Go on.
One thing I think that's important for everybody to realize who's watching this video is the answer to the question, what kind of cancer is it, or what kind of bump is it, just by looking at it. They say, Doc, what do you think about this bump? Can you check it out for me? And they expect us to look at the bump and then to feel it with the fingertips. And this is not a very reliable way of telling whether a bump is a cancer bump or not.
It's a really important process for finding out what you're dealing with. Dr. Dressler in Hawaii, Dr. Ettinger in New York, thank you so much.
Thank you.